Joining me now to discuss is Dr. Christopher Labos. He's an epidemiologist and cardiologist. Dr. Labos, good morning to you. How concerning is this?
Well, I think mpox is concerning, even if the number of cases in Canada is still relatively small. It's obviously more than it was last year, and that's a concern because you don't want to see cases increasing. But we have a tendency in this country and across the world to adopt an out of sight, out of mind problem. And so if you're walking around any city in Canada right now, you might say to yourself, well, mpox doesn't seem like a major concern. I'm not at risk. And as you know, most people watching us right now aren't. But this is still a global problem. And even if it's not a major issue in Canada, it is a major issue globally. And if we don't deal with it properly as an international community, it may become a major problem in Canada, as we saw in 2022, when the mpox became not just an issue in Africa, but an issue around the world.
Well, I think a lot of people are wondering is this deja vu? I mean, they're thinking about how COVID started, and it also seemed very far away. We're looking at a surge of cases in mpox in Toronto. So what are the key factors, doctor, that are leading to the spread of this disease?
Well, so there's a couple of things. The clade that's causing the issues now in Africa, specifically in the Democratic Republic of Congo, does seem to be a more severe version to the one that was circulating in 2022. So that's part of the reason why you're seeing more severe cases in Africa. With respect to Canada, again, it's the way this virus spreads. It is close contact. It is physical contact with an infected person. When you have enough people infected, cases will start going up. And so while we had very few cases last year, now, if you put the right circumstances in place, a slightly more infectious and more severe virus, a small number of people being infected, more international travel, all of those factors can eventually lead to a situation where you start seeing local spread. And that's what seems to be happening now. We're seeing local spread of this virus because it is circulating in the community. In 2022, the epicenter was largely in Montreal. Now it seems to be in Toronto. These are the sorts of things that can happen when you don't control a disease at its source.
Doctor, what is mpox and how does it present?
So mpox, what we used to call monkeypox, although it was renamed in 2022, it is related to smallpox. The word pox is a generic term in medicine. It means it's used to describe the stereotypical, the typical rash that you would see with mpox. So the way it spreads, I mean, there has been a lot of speculation about it. It is largely a contact spread virus. So when you're in close contact with individuals, especially skin-to-skin contact, that's where you see transmission. There's been a lot of talk about it circulating in specific communities amongst men who have sex with men, bisexual men, sex workers, things of that nature. I think that has led to the misconception by some people that it's a sexually transmitted infection, which is not true. It does appear to spread regardless of the contact. It's just that by chance, to a certain degree, it seems to have embedded itself within this community, which is why you're seeing spread amongst members of that community.
Last question. Is there a vaccine available to the public?
So there is a vaccine available. The situation in Canada is still controlled to the point that we don't need to have a mass vaccination program. And that's why Toronto Public Health is saying that it's particularly the high-risk individuals, all those previous groups that I mentioned, that should get vaccinated. The real issue is going to be going forward is, can we mobilize as an international community to get vaccine doses to where they are desperately needed? And that is Africa right now. So we have a vaccine. We can control this virus. The real issue is going to be, if we declare an international emergency on this, can we make the selfless decision to allocate resources to getting vaccine doses to Africa to save lives? Because people are dying of mpox in Africa. And that's going to be the real issue. Can we remember that this is a global emergency, not just a localized one?
Actually, I'll squeeze in one last quick question. If I could get a short answer, please, Doctor. Which way do you think the WHO is going to go on this? They're deciding right now whether or not to declare a global emergency.
I think they probably will. If they did it in 2022, I mean, the same criteria are present now. So we'll see, but I suspect they will declare the emergency.
Dr. Labos, thanks so much. Good to see you this morning. Appreciate your time with us.